A patient at a New York hospital remains in isolation today as doctors are awaiting test results to determine if the man contracted the Ebola virus, which has, of course, killed more than 800 people in Africa. The patient walked into the emergency room at Mount Sinai Hospital on the Upper East Side unannounced yesterday afternoon, showed signs consistent with Ebola, high fever, gastrointestinal problems, and he had just returned from a trip to West Africa. However, health officials are saying it is still very, very unlikely that the patient actually does have the Ebola virus. It takes a day or two to determine this, although he is going to be held in isolation until we determine what it is. COO of the hospital, Dr. David Reich, said, "We believe that the care that can be provided here would be sufficient for any patient with that disease." Up to this point, Center for Disease Control says 3 other people have been tested in the U.S., all 3 have tested negative. Only about 40% of those who contract Ebola survive. There is no specific treatment for Ebola. Treatment is primarily supportive. It includes minimizing invasive procedures, balancing fluids and electrolytes to prevent dehydration, and some people do survive and recover, of course. The main thing is, Lewis, tensions right now are really, really high. Not the least of which is a result of fears over Central American immigrants bringing Ebola over the U.S.-Mexico border, which the CDC has said is absolutely not a concern. But we have to remember that many things cause a high fever and gastrointestinal symptoms. And I know people who have been to Africa and had those symptoms, and it was related to food poisoning and not at all connected with Ebola. So we have to just wait and see here.
Indeed, we do, but we should still be on high alert. This is a crazy disease. Like we talked about before, it has something like a 20 to 30 day incubation period.
21 days, yeah.
And it can spread like wildfire. And it's good to be extremely cautious about this.
Of course, it's also interesting that we keep hearing from anti-immigration right-wingers that the problem with Ebola is it coming through the U.S.-Mexico border. Very little being suggested about all of the people who are just traveling to Africa and coming back, people with money who can afford the plane tickets. We hear very little about quarantining them for 21 days since the 21-day incubation period exists. They don't seem as concerned about that.
No. But it must be a little bit scary to hear about this happening in New York, because if things are going to become a disaster, it would be in such a densely populated place with a major hub of like that, the airport.